Picture this. You're expecting a baby. You're out for a nice, quiet walk, maybe just strolling through your own neighborhood.
Right, just a totally normal day.
Exactly. And out of nowhere, a dog bites you. And yeah, the physical pain is there, sure, but almost instantly, it is completely eclipsed by this massive, overwhelming wave of maternal panic.
Oh, absolutely.
Your heart rate spikes, your mind races, and everything basically boils down to one single terrifying question. Will this harm my baby?
It really is the ultimate nightmare scenario for any expecting mother.
Huh.
That immediate spike of adrenaline, the absolute terror. I mean, it's a completely natural evolutionary response.
Right.
Suddenly, this chaotic event on a sidewalk feels like an existential threat to the life you're carrying.
Well, we want to take that scenario today, that intense, blinding spike of anxiety, and just completely dismantle it for you.
Yes.
Our mission in this bitter dive is to replace that panic with calm, actionable, scientific empowerment. We are going to map out the exact critical medical steps you need to take.
Step by step.
Exactly. Consider this your reassuring guide to prove that, when handled correctly, both you and your baby are going to be completely safe.
And to lower that anxiety right out of the gate, we really need to establish a foundational truth here.
Okay, what is that?
The dog bite itself, like the actual physical trauma of a standard bite, rarely affects the fetus.
Oh, really?
Yeah. The only real systemic danger to your child in this scenario is if you delay treatment. If you act quickly and follow the science, the threat is entirely neutralized.
So, if the clock starts ticking the second the bite happens, what is the absolute first move? Because, I imagine most people's instinct is to just jump in the car and speed to the emergency room.
Yes, rushing to the hospital is vital. But there is actually a critical step that has to happen before you even grab your car keys.
Wait, before the hospital?
Before the hospital. We are talking about the first 15 minutes. The immediate first aid protocol dictates that you must wash the wound thoroughly with soap and running water for at least 15 straight minutes.
Wow, okay. 15 minutes standing over a sink feels like an absolute eternity when you're panicking.
It does. It really does.
But this isn't just about, general hygiene or making the wound look less messy, is it? Because I like to think of a 15-minute scrub as like a mechanical eviction of the rabies virus.
That is actually the perfect way to visualize it. It's a combination of chemistry and just brute physical force.
Okay, break that down for me.
So the rabies virus, like many viruses, is encased in a lipid envelope. To put it simply, it wears this protective outer coat made of fat.
Right.
Now, what does soap do to a greasy pan?
It cuts through the grease. It breaks down the fats.
Exactly. The chemical molecules in soap literally wedge themselves into that protective viral envelope and shatter it. They basically neutralize the virus on contact.
So the soap actually disarms the virus, and then the running water washes away the debris?
Yes, exactly. The sheer physical pressure of water rushing over the wound for sustained 15 minutes physically removes a massive amount of the viral load.
Before it can even get into the body.
Right, before it even has a chance to settle into your tissues, you are literally flushing the threat down the drain.
Okay, I can see how that works biologically, but let's talk about human nature for a second.
Sure. Yeah.
Because if I'm standing there and my arm or my leg is bleeding, my instinct isn't to stand under a faucet washing my blood go down the drain.
It's totally counterintuitive.
Right. The natural human instinct is to grab a cloth, tie it tight, or apply some kind of pressure poultice to stop the bleeding.
Which is what people have done for centuries.
Exactly. We hear about people packing wounds with turmeric or chili powder, oil, even ash. So why is that natural instinct to cover and pack the wound so dangerous in this specific scenario?
It's dangerous because it provides a false sense of security while actively aiding the virus. I mean, it is completely understandable to want to stop bleeding.
Sure.
But rabies is a disease that is almost 100% fatal once symptoms develop. There is no cure once it takes hold. And traditional remedies like turmeric or oil, while they might have some mild antibacterial properties in other contexts, they do absolutely nothing to break down the lipid envelope of the rabies virus.
So if I pack a dog bite with oil and tie a cloth around it, what is actually happening at a microscopic level?
You are essentially sealing the virus inside the wound. You're giving it a dark, moist, protected environment.
Oh, that sounds terrible.
It is. Furthermore, covering it with unsterile cloths or tying it off tightly without washing it first traps all the pathogens right at the entry point.
So you're basically locking it in.
Exactly. The rabies virus now has undisturbed time to find the local nerve endings. That 15-minute wash is your absolute first line of defense to physically disrupt that process.
And after that 15 minutes?
Once you've done that, you follow it up with an antiseptic like povidone iodine, chlorhexidine, or even just 70% alcohol if you have it.
Okay, so you do the 15-minute chemical and physical eviction, apply the antiseptic, and then you head straight to the hospital. No wait-and-see approach.
Definitely no waiting.
So when I walk through the ER doors, what is the doctor actually looking for? Because they have to figure out how bad the bite is, right?
Right. The doctor will immediately begin a triage process. And they use the World Health Organization, or WHO, bite categories.
Okay.
It's a very specific global standard used to assess the risk of rabies and dictate the exact treatment you need.
So how does that categorization actually work?
It's broken down into 3 levels of severity. So let's start with Category I.
Okay.
This involves interactions like just touching or feeding the animal, or maybe a dog licking your intact skin. For a Category I exposure, the treatment is simple. No vaccine is required.
So just a lick on the hand, no harm, no foul.
Exactly, because intact skin is a phenomenal biological fortress. It is this literal wall of dead cells that viruses just cannot penetrate.
Makes sense.
Yeah, if the skin isn't broken, the rabies virus simply has no doorway into your system.
But I assume that changes the second the skin is compromised even a little bit.
Drastically.
Yeah.
Which brings us to Category 2. This classification covers minor scratches or small abrasions where there is no visible bleeding.
Wait, no bleeding?
Right. But if the doctor classifies your exposure as Category 2, the protocol mandates the rabies vaccine.
Okay, this bursts a massive myth right here. I think a lot of people, assume that if the dog's tooth just grazed them and there is absolutely no blood, there's no need to sit in an emergency room for hours.
And relying on that no bleeding, no treatment myth is incredibly dangerous.
Why is that?
Because the rabies virus is microscopic. It does not need a gaping, bloody wound to enter your body.
Yeah.
It only requires a microscopic doorway.
Wow.
Even a minor scratch from a dog's nail that doesn't draw visible blood can create these tiny micro tears in the topmost layer of your skin.
And that's enough.
That's enough. If there is infected saliva on that nail or tooth, the virus now has access to your live tissues. That is why a bloodless scratch still demands the vaccine.
Okay, so if a tiny bloodless scratch gets me the vaccine, what on earth happens in Category 3?
Well, Category 3 is the highest threat level. It obviously includes the severe scenarios, bites with bleeding, deep puncture wounds, multiple bites.
Right, the obvious ones.
But it also includes any lick on broken skin.
Wait, really? A simple lick from a dog can be classified as a Category 3 emergency, the absolute highest threat level, just because you had a pre-existing scrape on your knee.
I know, it does sound extreme.
Yeah.
But that's until we look at how the rabies virus actually travels through the body.
Okay, how does it travel?
The virus thrives in the saliva of the infected animal. So if a dog licks an open wound, they are depositing live virus directly into your unprotected tissues.
And then it gets into the blood.
No. And here is what makes rabies so insidious. Unlike almost every other infection that travels through your bloodstream, rabies completely avoids the blood.
It avoids the blood. Why?
Because the bloodstream is heavily patrolled by your immune system's white blood cells. If rabies enters the blood, it gets detected and destroyed pretty quickly.
So where does it go?
Instead, the virus seeks out your peripheral nervous system. It finds the local nerves at the site of the wound, enters them, and literally hitches a ride up the axons.
The axons.
Yeah, the long thread-like parts of the nerve cells. It travels centimeter by centimeter, basically hidden inside your own nervous system, making its way toward the brain.
Oh, wow. So it uses your own wiring to bypass the body's security system.
Precisely. It's incredibly stealthy. And this unique method of travel is exactly why Category 3 also specifically includes any bite on the face, the head, neck, hands, or genitals.
Regardless of whether it's deep or not.
Regardless of whether it's a deep puncture or just a scratch.
Because of the geography of the body, like a bite to the face is just physically closer to the brain.
The physical proximity is definitely one factor. A bite to the neck or face gives the virus a very short commute to its ultimate target.
Right.
But it's also about nerve density. Think about your hands, for example.
Yeah.
They are packed with incredibly dense, highly sensitive networks of nerve endings. A bite to the hand gives the virus millions of immediate on-ramps to that nervous system highway.
That makes total sense.
Because the risk of the virus reaching the brain quickly is so magnified in these areas, the treatment for Category 3 must be aggressive. You need the rabies vaccine plus rabies immunoglobulin, which is known as RIG.
Okay, and we've arrived at the core anxiety for the expectant mother.
Yes, the treatments.
You're sitting in the ER, your heart is still pounding, and the doctor tells you that you have a Category 3 exposure. They say you need a full schedule of vaccines and this immunoglobulin.
It sounds overwhelming.
It does, because when you are pregnant, you are hypervigilant about everything you put into your body. You scrutinize the ingredients in your prenatal vitamins, you avoid sushi, you avoid certain deli meats.
Exactly.
So the idea of injecting multiple potent medications into your bloodstream feels absolutely terrifying. Will these treatments harm the growing baby?
The definitive, scientifically absolute answer is no.
Okay, that is a huge relief.
The rabies vaccine and the rabies immunoglobulin will not harm the baby. The medical consensus is crystal clear on this. Pregnancy is never, under any circumstances, a reason to avoid or delay rabies treatment.
I think the fear really stems from a misunderstanding of what a vaccine actually is. People worry they are being injected with a mild version of the rabies virus that might somehow cross the placenta and infect the fetus.
That fear is totally based on older, outdated medical technologies. Decades ago, vaccines were sometimes derived from nerve tissues, and they did carry higher risks.
But not anymore.
No. Today, hospitals use modern cell culture vaccines.
So what does cell culture actually mean for the patient sitting there?
It means the vaccine is cultivated in a highly controlled, sterile laboratory environment. They often use chick embryo cells or vero cells.
Okay.
The most crucial thing to understand is that the virus used to create the vaccine is completely inactivated. It is dead.
Good to know.
There is no live rabies virus in the syringe. It is biologically impossible for a modern cell culture rabies vaccine to give you or your baby rabies.
So what is it doing then?
You are simply showing your immune system the neutralized remains of the virus so it can learn how to fight it.
That makes total sense. You are injecting a blueprint, not a threat.
Exactly.
And the schedule for these vaccines is pretty rigid, isn't it?
Very rigid. The universally accepted schedule involves a series of intramuscular injections. The first dose is given on day 0, which is the day you seek treatment.
Okay.
You then return for subsequent doses on day 3, day 7, and day 14. And in some regions, depending on local public health guidelines, there may also be a final dose on day 28.
And you can't skip any of them.
No, it is absolutely vital to complete the full course.
But the vaccine is only half the equation for a Category 3 bite. The doctor is also going to administer RIG, the rabies immunoglobulin.
Right.
Help me understand how these two things work together. Because if the vaccine is a blueprint for my immune system, building that immune response takes time, right? Maybe a week or two?
Exactly. The vaccine provides what we call active immunity. Your body is doing the heavy lifting to build its own army of antibodies. But, yeah, that takes time.
And if you have a Category 3 bite on your hand, you don't have a week. The virus is already at the gates.
Right, it's moving.
So administering the RIG feels like calling in a biological SWAT team.
I love that analogy.
Like, the vaccine is hanging up wanted posters so the local police force can mobilize over the next few weeks, but the RIG is a team of pre-made, borrowed antibodies. You deploy the SWAT team to hold the perimeter and neutralize the threat immediately while the vaccine does its long-term work.
That is exactly how it works. And because it is a SWAT team, the medical staff deploys them directly at the scene of the crime.
What do you mean?
When they administer rabies immunoglobulin, they don't just give you a shot in the arm. The doctor will carefully inject the RIG directly into and around the wound itself.
Wait, they inject it right into the torn tissue of the bite?
Yes. They physically infiltrate the edges of the wound with these borrowed antibodies. The goal is to flood the local tissue and neutralize the rabies virus before it can even find the nerve endings.
Wow.
They are essentially barricading the on-ramps to the nervous system. And if there's any RIG left over in the syringe after the wound is fully infiltrated, they will inject the remainder deep into a muscle on the opposite side of your body from where they gave the vaccine.
Why the opposite side of the body? That seems so specific.
It is. Because you don't want the borrowed SWAT team, the RIG, to accidentally neutralize the dead virus in the vaccine before your own immune system gets a chance to study it.
Oh, that makes so much sense.
Yeah, you keep the treatments geographically separated in the body. And just to bring it all back to the mother's primary concern, both the cell culture vaccines and the rabies immunoglobulin are profoundly safe during pregnancy.
So they are your shield.
They are your shield. The only danger is the virus itself.
It is incredibly relieving to know the rabies threat can be neutralized so completely. But a dog's mouth is a complex ecosystem.
Oh, it really is.
Rabies is the most terrifying threat, obviously, but it's certainly not the only one. What else is living in a dog's mouth that an expectant mother needs to worry about if the skin is broken?
Well, This is where we look at the secondary risks, starting with tetanus. A dog bite, especially a puncture wound from a canine tooth, is highly prone to tetanus infection.
Really?
Yeah.
Because most people associate tetanus with, like, stepping on a rusty nail in an old barn. Why does a dog bite trigger a tetanus warning?
It has to do with the nature of the wound and the bacteria itself. Tetanus spores are ubiquitous in the environment. They are in soil, dust, animal feces.
And dogs get into all of that.
Right. A dog's mouth interacts with all of those things, but tetanus bacteria are also anaerobic.
Meaning they don't like oxygen.
Exactly. They thrive in environments where there is no oxygen. So a deep puncture wound from a tooth creates a perfectly sealed, oxygen-free pocket deep in your tissue. It is the ideal breeding ground for tetanus.
So the doctor will definitely check your vaccination records.
Yes. If your tetanus booster isn't up to date, they will administer a tetanus toxoid or Tdap vaccine.
And is that safe?
Yes. And again, to dispel any lingering fears, the tetanus vaccine is highly recommended and routinely given during pregnancy to protect both the mother and the newborn.
Okay, good. Aside from tetanus, what about standard bacterial infections? Because I imagine a deep wound in a sensitive area is going to get inflamed pretty quickly.
Oh, definitely. You're dealing with the dog's natural microbiome. One of the most common culprits in dog and cat bites is a bacteria called Pastorella.
Pastorella.
Yeah, it can cause rapid, severe tissue infections, especially deep wounds, crush injuries, or bites to the hands and face.
So they put you on antibiotics as a preventative measure.
Frequently, yes. The first-line defense is usually an antibiotic like amoxicillin combined with clavulanic acid.
And for someone who is pregnant.
This specific combination is widely used in obstetrics and is considered very safe for pregnant women when a doctor determines it's necessary to prevent a systemic bacterial infection.
Okay, so we've covered the entire medical gauntlet. You did your 15-minute mechanical eviction with soap and water.
Right.
The doctor assessed the WHO category. You got the cell culture vaccine, the ridge infiltrated into the wound, a tetanus booster, and a prescription for pregnancy-safe antibiotics.
You are well protected at that point.
Your body is protected. Now let's talk about the animal, because the clinical guidelines suggest that if the dog is a known pet or is available for observation, you should watch it for 10 days.
Yes, that 10-day observation period is a standard public health protocol.
What's the thinking there?
The logic is that if a dog or cat is actually shedding the rabies virus in its saliva at the exact moment it bites you, the animal will almost certainly succumb to the disease and show severe neurological symptoms within 10 days.
Ah, okay. So if the animal stays completely healthy for those 10 days, it basically implies it wasn't infectious when the bite occurred.
Correct.
Okay, but I want to explore the logic of this from the perspective of a tired, pregnant patient.
Fair enough. Let's hear it.
Let's say I'm at day 5 of the observation. It was my neighbor's dog. It bit me because I startled it. I've already had my day 0 and day 3 shots.
Right.
I look over the fence, and the dog is happily playing fetch. It's eating normally. It looks perfectly fine. Logic tells me that if the dog is perfectly healthy 5 days later, it didn't have rabies when it bit me.
Here we go.
So why isn't it safe to just call the clinic, cancel my day 7 and day 14 appointments, and save myself the exhaustion of more injections?
That is a very, very common thought process.
Yeah.
But acting on it is a catastrophic gamble.
Really? Why?
The flaw in that logic lies in the difference between the incubation period of a virus and viral shedding.
Okay, explain the difference for me.
So rabies is highly deceptive. The incubation period, which is the time the virus is slowly multiplying inside the animal's nervous system, that can last for weeks or even months.
Oh, wow.
During this time, the dog looks entirely normal. However, viral shedding, which is when the virus finally reaches the salivary glands and can be transmitted through a bite, that can begin several days before the dog shows any obvious visible symptoms like aggression, paralysis, or foaming at the mouth.
Wait, so a dog could be actively shedding a lethal virus into my bloodstream on Tuesday, but still look like a perfectly healthy, happy pet playing fetch on Friday?
Exactly. As a layman observing a dog over a fence, you do not have the clinical expertise to determine if subtle neurological shifts are occurring.
I guess not.
You absolutely cannot stop a vaccine schedule for a disease that has a 100% fatality rate based on your own visual assessment of the animal.
That puts it in perspective.
The only time you alter or stop your rabies treatment is if a doctor or a public health authority explicitly reviews the veterinary data and tells you to stop. Otherwise, no matter how tired you are, you complete the full schedule.
It is remarkable when you pull all of these pieces together. The immediate 15-minute chemical disruption with SERP, understanding the microscopic mechanics of the WHO categories,
All of it.
knowing that modern cell culture vaccines and RIG are entirely safe for a developing baby and treating the secondary bacterial threats, it takes an event that feels entirely chaotic and terrifying and transforms it into a very clear scientific checklist.
Yes, exactly.
It is incredibly empowering to realize how preventable this tragedy actually is.
It is a profound triumph of modern medicine. I mean, think about it. A disease that was once a guaranteed death sentence has been rendered completely manageable, provided you follow the established protocols without hesitation.
So let's distill this into a rapid-fire recap for anyone listening who wants to lock these vital steps into their memory.
Perfect.
If the unthinkable happens and you are bitten by a dog while pregnant, step 1, immediately wash the wound vigorously with soap and running water for 15 full minutes to tear apart that viral envelope. Step 2, go to the hospital immediately. Don't wait to see if the wound gets inflamed. Step 3, reject the home remedies. No turmeric, no oil, and never assume that a lack of blighting means you are safe from microscopic entry points.
Crucial point there.
And most importantly, step 4, breathe a sigh of relief knowing that the modern rabies vaccine and the rabies immunoglobulin are fundamentally safe for both you and your growing baby.
Prompt, decisive treatment saves lives. And this is the kind of knowledge that shouldn't just be kept in medical textbooks. It needs to be common knowledge.
Absolutely.
Share this information with your family, your friends, and certainly anyone who is expecting. We want this protocol in their minds long before they ever need it, so they never have to panic on a sidewalk searching for answers on their phone.
Which brings us to the end of our deep dive today. We've talked a lot about physical barriers, intact skin, the viral envelope barricading nerve endings. What is the final thought you're taking away from all of this?
Well, I keep thinking about the incredible nature of the placental barrier.
Okay, tell me more.
From a biological standpoint, it is this magnificent physical shield that evolves specifically to protect the developing baby from the trauma, the toxins, and pathogens of the outside world. It is the original safe space.
Beautiful way to look at it.
But in the case of a dog bite and a threat as insidious as rabies, that biological barrier simply isn't enough. In this highly specific scenario, it is the mother's swift, science-backed action that becomes the true shield.
Oh, yeah.
When a mother rejects old, dangerous myths, stands at a sink for 15 minutes, and willingly accepts modern medicine despite her anxieties, she is actively extending that protection.
That's powerful.
It forces us to redefine what true maternal instinct looks like in the modern world. It is no longer just about physically guarding the nest or applying a soothing remedy to a wound. True maternal instinct is about trusting the scientific method, enduring the inconvenience and anxiety of clinical treatments, and utilizing hard knowledge to protect the child.
You aren't just a victim reacting to a chaotic event on a sidewalk. You become the first responder. You turn on the tech, you seek out the vaccine, and through deliberate action, you keep that baby safe. Incredible. Thank you for joining us on this deep dive. Stay curious, stay informed, and we'll catch you next time.